Dear doctors, a very warm welcome to all of you. Myself, Dr. Vaidehi Desai Shah. I am a consultant robotic and laparoscopic gynecologic surgeon and an obstetrician and an international faculty for obstetrics and gynecology. So today we are going to discuss the 5th episode of COVID Diaries. So I welcome all of you to my official YouTube channel, Dr. Vaidehi Desai Shah's Obstetrics and Gynaecology. I also invite you to join my Facebook page, Dr. Vaidehi Desai Shah's Obstetrics and Gynaecology Discussion Forum. So let's begin the 5th episode of COVID Diaries in Obstetrics and Gynaecology. Do like, subscribe and share my YouTube channel. So welcome to the 5th episode, and our patient is a 26-year-old para 2 with one previous abortion female with normal vaginal delivery. Postpartum day 6. She presents with history of fever, cough, irritation in the throat, generalized weakness. So these are the chief complaints of the patient. On examination, her pulse is 80 beats per minute, blood pressure is 120 over 74 millimeters of mercury, temperature is 100 degrees Fahrenheit, saturation is 98%, respiratory rate is 16 per minute, pallor is positive. Her abdominal examination shows uterine involution, non-tender and non-tenderness. Okay, so uterus is non-tender. And there is secretion of yellow to pink lochia. So is that a finding consistent with the postpartum day 6? Yes, that is a normal finding, consistent with the normal postpartum day 6, right? So it is a normal postpartum day 6 finding, all right? It is not an indication of abnormal lochia, right? Remember that the uterus is non-tender. So it is a good sign, right? There are no infections, no endometritis, right? For vaginal examination shows normal findings. So there is no foul smelling lochia. So we do not suspect any other abnormal puerperal infection here, right? Now, so this fever cannot be attributed to the puerperal sepsis, all right? Puerperal fever or puerperal sepsis. So the fever that we have here, what is the cause of this fever? Now we will be investigating the cause of the fever, all right? So the lab investigations show hemoglobin of 11 grams per deciliter, WBCs of 4,000 per liter, platelets to be normal, lymphocyte level is slightly increased, and the infant weighs 3 kilos and is normal on examination. Rapid antigen test for COVID-19 is positive. So now we know that the cause of the fever is not puerperal sepsis in this case, and it is COVID-19, right? Which has caused fever. The woman is advised home isolation with symptomatic care. All of the following are advised to the female except option A, monitor the symptoms and oxygen saturation regularly. Option B, isolate away from child, do not breastfeed. Option C, proper precautions to be followed while administering the express breast milk. And option D, proper precautions to be followed while administering the breast milk. Right? Now, out of all these options, if you look at this question at a glance, you will find that either option C or option D has to be an incorrect one, right? Because it cannot be proper precautions to be followed while administering express breast milk or while administering the breast milk. There is some problem between C and D, right? Now let us look at the guidelines, the management guidelines from the WHO. And according to these guidelines, they have given breastfeeding guidelines for COVID-19 positive mothers. If a woman is COVID-19, if after birth the mother is asymptomatic or displays few symptoms, then rooming in can be allowed, and direct breastfeeding can also be allowed, provided that she puts on a mask during breastfeeding. She observes proper hand washing prior to handling the infant. These are certain things which she must be practicing, right? One thing I want to emphasize here is that rooming in means mother and baby both can stay in the same room, and there can be direct breastfeeding. Now, if a mother has cough, fever, dyspnea, or if the newborn needs intensive care unit, care, that is ICU care. In those conditions, there may be mother-infant separation, and in those conditions, infant must be given expressed breast milk. What is expressed breast milk? It is a breast milk pumped from the mother's own breast and given into the bottle, right? So basically it is a pump or the expressed breast milk, right? What is still recommended is that 6 feet distance must be observed when not feeding. So even if we recommend rooming in for the mother, 6 feet safe distance, that is 2 meters safe distance, must still be practiced, and visitors must be suspended. See, of course, whenever a new child is born, there are so many visitors who come to bless the baby, right? But in this COVID-19 pregnancy, this is one thing which must be taken note of. Visitors and the visits must be suspended. All right. Remember that there is no evidence of transmission of SARS-CoV-2 through breast milk reported to date, and expressed breast milk should be given as the mother can pass antibodies via her breast milk. So this is very, very important. Breast milk is best for baby, even in COVID pandemic crisis, right? Even in COVID times, breast milk is best for baby. Now, what are the infant recommendations? These were all about the mother recommendations, maternal recommendations. Now we will discuss the infant recommendations. In the infant recommendations, the infants who are born to COVID positive mothers should have RT-PCR, RNA of pharyngeal swab or SARS-CoV-2 weekly done until 28 weeks old. Meaning to say they must have at least 4 COVID tests done in the neonatal period. Second is 1 week observation in hospital after birth is prescribed. So these are certain guidelines which are prevailing for the breastfeeding in case of COVID-19 positive mothers. So thank you all for your patient listening. So the answer to this question is option B. Isolate away from the child, do not breastfeed. That can never be an option. Remember that breastfeeding is best for baby. All right? Even in COVID crisis. So thank you all for your patient listening. This is Dr. Vaidehi Desai Shah signing off. Do like, subscribe and share my official YouTube channel, Dr. Vaidehi Desai Shah's Obstetrics and Gynaecology. You can also join my Facebook page, Dr. Vaidehi Desai Shah's Obstetrics and Gynaecology Discussion Forum. Good luck. Bye. Take care.